So, as we move on, it is time to listen to the Managing Director of Jammi Pharmaceuticals, Dr. Jammi, also a Vamsha-Vaidya awardee. It is time to thank our sponsors, and over to you, Doctor.
Yes, this is the one. So, I think it's a very important conversation that we're going to have today, the importance of prebiotics on human health. So what if I told you that none of us is actually fully human? So that might come as a surprise to you. We are not fully human. What does that even mean? Well, that means that about 4 kilos of your body weight is actually from bacteria that reside in your gut. So that's what I mean by saying that you're not fully human. Now, next slide. Yeah. So we have about 100 trillion microbes in the human body, right? And 23,000 human genes versus more than 1 million microbial genes that we have in the human body. And human genes do not alone define what is human health. As a matter of fact, the bacterial genes are actually even more important than human genes when it comes to defining human health. What does it mean when I say gut flora, gut microbiota? This is what the microbiome means. So the microbiome is a sum total of all bacteria and other organisms found in the human body, and that's called the microbiome. And what is its connection to human health? So the systems affected by the microbiome are many. As a matter of fact, all aspects of human health are affected by the microbiome, including the central nervous system, obviously the digestive system, the hematological system, the immune system, the cardiovascular system, and the endocrine system. And it has its parallels in human health in Ayurveda as well. So these include Ojas, Agni, the removal of ama in the form of toxins, and also they affect the manas, the psychological aspect of the food that you eat. So good gut health has a very important aspect on your immunity. In fact, 80% of human health, human immunity resides in the gut and not in the blood as most people think. And how do you maintain good health? By making sure that you imbibe the right kind of prebiotics and probiotics. Everybody knows what probiotics are. You know, lassi, curds, chas, buttermilk, all of these are probiotics. So they contain live bacterial organisms in them, and they are things that you imbibe and help with gut health. But what are prebiotics? As a matter of fact, prebiotics are more important than probiotics when it comes to human health. And that human health has got 3 axes: the gut-liver axis, the gut-lung axis, and the gut-brain axis. All of these are important in maintaining human health. What is the gut-liver axis? Why is it so important? How is it that gut-liver axis affects human health? The liver axis, the gut-liver axis, refers to a two-way bidirectional communication system between the gut and the liver. There are several short-chain fatty acids that are generated by the gut that communicate with the liver, and the liver produces bile and bile acids that impact the gut microbiome. Now, why is liver health so important? You know, there was an yesteryear actor called Jammi Ganeshan, and he said to be a good liver, you need a good liver. And it's ironic that he died of liver failure. So he was a patient way back in the 60s, and despite what my grandfather kept telling him about not consuming the unnecessary items, he could not help himself, and he said, I'm used to doing this, I will deal with it as it may. So why is the liver so important? The liver is one of those organs that affects all aspects of the human health, and this is called a pleiotropic organ. in modern scientific parlance. A pleiotropy is where one particular organ or gene controls many activities. And I don't want to bore you with all the information as far as what the liver does, but suffice it to say that it has such an important effect on bone health, obviously insulin resistance. It also plays a role in eye health, blood pressure. Not a lot of people know that the key aspect to controlling blood pressure is a properly functioning optimal liver. And hormone metabolism, most hormones are made in the liver, most hormones are catabolized in the liver, and then it is the seat of metabolism for all sex hormones. It is a key pathway in serotonin metabolism, where it's been shown to have a very profound impact on migraine pathophysiology. And there are so many other new liver hormones that have been discovered in the last 10 to 15 years, that one of them is phetuin, which plays various roles in bone health, cardiovascular health, insulin signaling and inflammation. Activin E, this increases fatty acid oxidation. Then the Sukushi hormone, which is, increases thermogenesis, which is a very fancy way of saying burning calories. And several of the hormones whose functions are yet to be elucidated. So what is the gut-brain axis? We spoke about the gut-liver axis. What is the gut-brain axis? The gut-brain axis is the communication system between the brain and the gut via what's called the vagus nerve, which is the longest nerve in the human body, right? And the gut-lung axis is the communication between the gut and the lung, using various different small molecules like lipopolysaccharides, short-chain fatty acids like butyric acid, and then desaminotyrosin. All of these things are very important in making sure that the lung also has its set of microbiome, and that has to be the right kind of microbiome. And if you don't have the right kind of microbiome, you end up having diseases like COVID, flu, and other respiratory diseases. The gut microbiome and the cardiovascular health are also inexorably connected by a couple of small molecules called TMAO, trimethylamine N-oxide, and the dietary phosphatidylcholine, which is a pro-atherosclerotic metabolite, meaning this causes atherosclerosis. So this happens more often in people with an omnivorous diet, also known as a Western diet, and less in vegetarians. And this leads to dysbiosis. When you have dysbiosis, which is the opposite of symbiosis, this leads to what's called a leaky gut, okay? And when you have metabolites like short-chain fatty acids, this help in maintaining the integrity of the gut barrier, thus preventing toxin leakage into the lumen of the gut. Leaky gut in human health, again, a leaky gut, when you don't have proper microbiome in the gut, leads to several diseases and disorders in the human body. This includes diseases of the mouth, the sinuses, the adrenal glands, which leads to fatigue, joints, believe it or not, rheumatoid arthritis, fibromyalgia, headaches. All of these are caused when you don't have a properly functioning gut microbiome. Brain leads to depression, anxiety, skin problems, thyroid problems, colon. So basically, the gut controls 90% of human health. And prebiotics are the key. Now, it's very important, if there are any students over here, to understand what prebiotics mean. They're very different from probiotics. Prebiotics are selectively fermentable ingredients found in your diet. Obviously, you'll have to take them. That results in specific changes in the composition and activity of the gastrointestinal microbiota. Now, this should be indigestible by us, human beings, but should be fermentable by the gut microbiota. That is a prebiotic. And there are certain criterion that has been brought upon as be classified as a prebiotic. The first one is that it should be resistant to the stomach acid pH. So it should be able to survive that harsh conditions of the stomach acid. It should not be hydrolyzed by the mammalian enzymes, and should also not be absorbed by the GI tract. So all of these criterion must be satisfied. It has to be fermented by the intestinal microbiota, and the growth and activity of the intestinal bacteria should be selectively stimulated by this compound, and most importantly, it should confer benefits to the host organism, in this case human beings. So if it is beneficial to the host organism, then it's called a prebiotic. So a definition, a substrate that is selectively utilized by host microorganisms conferring a health benefit is called a prebiotic. Studies have shown that germ-free mice, so they take mice, remove all the gut microbiome from the mice, and they subject it to experiments, and it's shown that it can have a altered biochemical metabolism profile when compared to regular mice. And this communication is extremely complex. You need to make sure that we understand this at a molecular scientific level to understand how the gut and the brain communicate with each other. Suffice it to say, you understand that if you don't eat properly, you end up having an upset stomach, and that also could lead to problems in your mood. So this is not something that's psychological, this is actually physiological. Gut microbiota and stress-related behavior. So again, when you are under stress, you realize that you don't eat properly. You've seen this a lot of times, and this is again not psychological, it's physiological, because the neurotransmitters generated by the brain actually affect the gut microbiome, and that in turn affects your overall digestive system. And another important point is, why should expecting mothers be stress-free? Because we make such a big point about being stress-free, and it is a practice in our country, in our culture, for the expecting mothers to go stay with their parents. That's because they should be stress-free. And why should they be stress-free? Because when the mother is under stress, the fetus can be subjected to several physical effects later on during its adulthood. For example, it could have a reduced birth weight, it could have delayed maturation, and it could be at a higher risk for certain diseases like diabetes. Cardiac effects, enhanced blood pressure could happen, and then increased risk for coronary artery disease. And then developmental effects. They could have impaired executive function, lower gonadotropin release hormone release, then higher immune activation, meaning they have a very hyperactive immune system, which is again not a good thing, and increased anxiety. So all of this could happen to the child born from a mother who's stressed out during her pregnancy. So, and then chronic inflammation and diabetes. Chronic inflammation is the root cause of all lifestyle diseases. It is very important that we understand that inflammation is not something that is an acute problem. When you fall down or you get hurt, of course there's going to be inflammation at the site of wound. But chronic inflammation is something that happens over years, and that leads to a lot of lifestyle problems, including diabetes. So in order for you to be able to control or reverse diabetes, we must understand that chronic inflammation also must be controlled, addressed. There are several types of prebiotics. Oligosaccharides, polysaccharides, and polyphenols are the three most important ones, of which oligosaccharides and polyphenols are the two most important oligosaccharides when it comes to promoting and conferring health benefits to the human being. This is a list of the intestinal microbiota. Of course, I don't expect you all to remember this, but suffice it to say that there are 100 trillion bacteria in the gut, and of which there are several different species that are beneficial for you. Of these species, you must make sure, when I say you, I mean all of us must make sure that we eat the right kind of diet, the right kind of food, to make sure that these bacteria thrive. And that can happen only when you have the right kind of prebiotic fibers present in our diet, which never happens because we don't cook the right kind of food, we don't have the right kind of fiber. So it becomes very important that when we use these sort of data, we also have to find out solutions for addressing human health. What happens when you take the right kind of prebiotics on the probiotic population in the gut? The fructooligosaccharides that I was talking about increases a species of bacteria called bifidobacterium. That outcome is overall digestive health is improved. Galacto-oligosaccharides again increases bifidobacterium, which leads to overall digestive health. Polyphenols increases lactobacillus, bifidobacteria, ruminococcus, all of which have increased diversity of overall bacterial community, decreased body weight. So you lose weight if you eat the right kind of prebiotics. Decreased incidence of cancers, better intestinal health. And which is the best probiotic that we are all aware of? Curds and lassi, because both of them contain lactobacillus and bifidobacterium, having curds and lassi. Again, curds again, as per Ayurveda, we are not supposed to have it at all points in time. Buttermilk or chas or lassi is a much preferred alternative, but they all contain bifidobacterium and lactobacillus. We must consume them on a regular basis, but it's not just enough if you consume only the probiotics. They must thrive. In order for them to thrive, you must consume prebiotics, because prebiotics is food for the probiotics, and that's what is very important, and that's the missing piece of the puzzle when it comes to curing lifestyle diseases. You are what you eat. That's what Ayurveda teaches us. The sattvic, rajasic, and tamasic tendencies that we are all exhibiting is because of the kind of food that we eat. It's very important that we pay attention to the kind of food we eat. And most importantly, we have neglected in taking in the prebiotics, which are absolutely necessary and important for the probiotics to thrive. So Jammis have come up with a very unique, innovative, this harkens back to the previous talk where we talk about innovation, where we've used modern science to actually come up with a Ayurvedic solution for prebiotic fibers. Now, prebiotics, when you want to buy them from the market, the fructo-oligosaccharides and galacto-oligosaccharides, you end up getting about 5 milligrams to 10 milligrams, maybe maximum 50 milligrams in a sachet. Now, is irrelevant. Whether you consume it or not makes no difference, because the amount of prebiotic fibers that you need per day is anywhere from 3 grams to 5 grams. And that is the amount you must consume when it comes to making sure that your gut is healthy. So we've come up with a unique combination that contains all the 3 different class of prebiotics: polyphenols, fructo-oligosaccharides, and galacto-oligosaccharides. And it's been successfully used clinically for various conditions, including migraines, diabetes, PCOS, liver diseases, cardiovascular conditions. They don't cure it, but what happens is when you take prebiotics along with the other medicines that we give, it hastens and speedens the recovery. And that is very, very important when it comes to making sure that human health is taken care of. So my recommendation to all the Vaidyas over here is to include prebiotics along with the rest of your treatment regimen to make sure that the patient gets cured faster and comes back to you for other problems as well. Thank you. I'll take any questions if you have it. Yes? I can't hear.
Thank you, doctor. That was a very insightful presentation by you. In fact, just wanted to know, probiotics, you said that it can be obtained from food, natural food like lassi, curd and all. What about prebiotics? It cannot be had from foods, or?
Very, very difficult. I mean, the amount of prebiotic that you need, for example, brinjal, cauliflower, Brussels sprouts, how much can you eat? Not all of it is prebiotics, right? So you have to consume, like I said, 3 to 5 grams. So it's very difficult to obtain that amount of prebiotics.
This medicine, what you showed, is a solution for that.
It's a solution for that. That's exactly right.
So can it be used even without doctor's prescription?
Yeah, this is a prebiotic that is it's pretty much over-the-counter, non-prescriptive based prebiotic.
Will it solve the problem of chronic inflammation which you spoke about?
Yeah, exactly. So chronic inflammation actually happens when you have dysbiosis. And you need to make sure that the dysbiotic state goes into a symbiotic state, which means you need to, the dysbiosis causes the leaky gut, the leakage of the toxins into the tissues. That's what you need to prevent. And there are junctions in the intestinal wall called gap junctions that need to be tightened. So that's what these help in, because they give the right kind of secondary metabolites.
Is it available in the stall that is there?
Yeah, it's there. It's there in the stall.
Thank you so much.
Thank you. Yeah. If there are no other questions, I'm very happy to address your questions one-on-one at the stall. So please visit our stall. It's in the exhibition area. Thank you.
Thank you very much, Dr. Jammi. I think sponsors are very important for every event, and your contribution towards this expo has been received with gratitude. I call upon Dr. Vijay Pal to felicitate Dr. Jammi on this occasion of National Ayurveda Congress 2026 and Ayush Expo. we would like to thank Dr. Jammi for his support.